main symptom women experience is stress urinary incontinence. When they cough, sneeze, run, get on the trampoline, have sexual intercourse, they will be aware of the uncontrolled leaking of urine. That is also to be compared to those women who have urge incontinence, where all of a sudden they have a sudden rush to get to the toilet, to pass water, and may not necessarily get there. Most women tend to have stress incontinence, which can be treated with either pelvic floor exercises, and sometimes if they're a little bit overweight, they ought to consider losing weight. And if having lost weight and being diligent in their pelvic floor exercises, they're still leaking, they may be a good candidate for a bladder operation where we generally put some sort of sling under the neck of a bladder to lift it up. This is generally a day case operation, and there are several different types around, and most women do very well after this. If a woman has what's called urge incontinence and she's running to the toilet, this can usually be treated quite nicely by a combination of medication to relax the bladder, the muscle in the bladder, exercises, and increasingly we are also now offering these patients with urge incontinence injections of botulinum, Botox, which is going directly into the bladder. So there are a range of treatments, and I think really the message to all women who have any urinary leakage is very straightforward. They shouldn't just put up with it. There's a great deal that can be done. So pluck up a little bit of courage and go along and see your GP, who will be able to refer you to a specialist who can help.